All right, welcome everyone. We're going to get started. Welcome to Oh Mama, Motherhood, Mental Health, and Sex. I'm so excited to have the opportunity to host this conversation today with these brilliant minds and hearts that are joining us, and really appreciate everybody who's here today. It looks like we have more than 25 people. We can't see you out there, but hello. Um, I want to introduce our speakers and share a little bit about this event. My name is Liz Stewart. I use she, her pronouns, and I am the Sexual Violence Prevention Outreach Specialist at Western Washington University and am a part of the Caregivers and Parents group, the CAP group, through Human Resources at Western. And that is the group that formed this committee on Maternal Mental Health Week to do some events and how we are able to host this cool event today. So as we get started today, I want to first of all just name that I have never hosted a webinar before, so technical things might go here and there and awry, and I might be learning as we go. So I just want to welcome and appreciate everyone's patience and compassion for me and for each other in this tender space on these tender topics. Tender, sexy, fun, wild, hard, complicated, all the experiences of life that are embodied in these topics. Um, and yeah, also just want to offer an invitation to inquiry here. So the format of this event will be that I will share kind of some guiding questions that we developed that are more structured, and that there's also a Q&A button, hopefully that you can see on your Zoom screen for you to submit questions toward the end. So we have designed this space for there to be some time for us to address your questions at the end. If we don't get to all your questions, because I'm sure you have lots of amazing ones, we will definitely create some way to be in touch with you and to share responses to your questions later. I also want to say that this is being recorded. And so if you need to leave, or if you are so psyched about it that you want to share it out with everyone that you know, which is probably going to be the case, we will have it captioned, closed captioned, and uploaded onto that website, the CAP website, as soon as that is humanly possible, because it requires human resources to close caption things well. A couple more quick notes. Oh, there goes one of those technical difficulties. Just slammed my headphones off of my own head. A couple other quick notes before we get started. I want to name that I'm coming to you from the ancestral lands of the Coast Salish people, and specifically of the Lummi and Nooksack nations. And I am naming that as an invitation to those of us who are the white settler folks to engage in learning from those communities, listening to those communities, and supporting the actions that those communities are engaged in stewarding this land, and have been stewarding this land for thousands of years, since time immemorial. So thank you for everyone being here today. The other thing that a couple notes that I want to make before we introduce our speakers. One is, we are talking about maternal mental health today. We're talking about sex. We're talking about motherhood. We're talking about mental health and mental hardship. And those things can be sticky, difficult, even triggering topics for folks. We all come with our own lived experiences, cultural backgrounds, family histories, comfort levels with talking about these topics. So just want to, again, invite a brave conversation that faces hard things and also notices our own edges when things might be triggering or too hard. We support you in feeling supported, and so please reach out to us if you need some support afterward, and please reach out to your communities and yeah, get the support you need, because you deserve it, everyone. And then my final note before we introduce our incredible speakers is that, we are doing our best to have an inclusive event. This is an event that focuses on people who identify as mothers and motherhood. Um, and mothers come in all bodies and all shapes and sizes. And Also, some of this information may be relevant to, dads who have given birth or who are breastfeeding, or non-binary parents as well. And we're working with some, binary language and limitations within the medical field and these other fields. So I guess my purpose with sharing that is that we don't want to harm anyone, and we want to be equitable, and we want to be moving towards liberation and support for each and every parent. And so if our language doesn't meet those aspirations, or if any harm is caused, I also want to invite you to be in conversation with me after this and invest in each other, to do better and grow. I know I always tell my kids, like, know better, grow better. We don't know all the things. I'm a white middle-class woman with lots of different privileges, and I'm going to miss things. So again, just an invitation to engage with me around those things. You don't owe me anything, but I want to do better, and I hope that you will help me learn together. So without further ado, I would like to introduce our incredible panelists today. And I will share a little information about them, and then invite each of you to introduce yourselves as well. So we have today Becky Shays, who is a certified nurse midwife and nurse practitioner in private practice, whose aim is to provide access to kind, respectful, and healing medicine. She's also a mother, activist, and a community organizer working to make Whatcom County a place where all families can thrive. Welcome, Becky. I invite you to introduce yourself as well, share your pronouns if that's something you want to do, and any other roles or identities that inform your work that you wish to share right now.
Thanks, Liz. So my preferred pronouns are she and her. And I would say that probably the identity that informs my work the most, besides mother, is that I am a survivor of sexual assault. And that is really where my work with women started, with my own healing journey, and still continues to inform my care. There's so much trauma is done to women's body in the name of medicine, that I make every effort possible in every interaction with a woman's body that I have, that those power dynamics are torn down. So that's really the root of why I do everything I do. And yeah, but definitely as a mom, I also run the Village Circle and co-founded that peer support group in Whatcom County. And I run that as a mom. So actually my nurse practitioner, nurse midwifery stuff is, it's kind of almost secondary. But it's like the pot I get into every day, where I get to be all these different things. So.
Thank you so much for sharing. And I want to just really thank you for your vulnerability and for naming, very hard things and stigmatized topics. That is making a difference in the world too. So I appreciate you sharing that. Next, we have the brilliant Dr. Elizabeth Watt, who is a licensed clinical psychologist and certified sex therapist through the American Association of Sexuality Education, Counselors and Therapists, also known as ASECT. Elizabeth has been providing therapy services to individual and partnered adults in Bellingham since 2015. She's also the mother to a toddler and is passionate about promoting sex-positive, pleasure-focused, identity-inclusive sex education. So, Dr. Watt, is there anything else you would like to introduce yourself or share identities that inform your work?
Sure. Well, pronouns she, hers. I really feel privileged and grateful to be invited into a space like this. I spend a lot of time listening to people's stories, whether that be, mothers or parents or partners, people at all different stages of their life. But this particular topic and thinking about maternal mental health in particular, for some obvious reasons, has a lot of charge for me at the moment, being a new mother. Yeah, and I feel really excited about the fact that we can even create a panel like this in our community. And I know from the way that I was asked to join that there were a lot of people who were interested in participating on the panel, which was even, a further sign that, okay, we really have a strong community here of helpers and supporters. So I'm both excited to share that and let people know that, and just feeling really, kind of resourced in my own way to be reminded of that. So yeah, I think that's all I want to say right now, but thanks for having me.
Yeah, thank you for joining us today. Let's see. Next, we have Dr. Caitlin. Okay, my thing says Caitlin Kahn, and your name says Caitlin Ford on there. Is that correct? My cheat sheet says Caitlin Kahn.
Billy Ford.
Okay.
You can say either. How about that?
Okay. Let's see. PT, DPT, OCS. You'll have to help us with what those mean. From Core Physio, received her doctorate in physical therapy from the University of Puget Sound and her Bachelor of Science in Psychology from the University of Washington. She earned board certification as an orthopedic clinical specialist through the American Board of Physical Therapy Specialties in 2017. That's a big deal. Board certified is a difficult thing to accomplish, I've heard. She also specializes in manual therapy, sports performance, pediatrics, women's health, including pregnancy and postpartum, and pediatric pelvic health. She's currently working toward her professional yoga therapy certification. A Bellingham native, Caitlin lives with her husband and 2 children. Anything else you'd like to share about yourself, Caitlin? Take it away.
Thank you. Thanks, Liz. And my preferred pronouns are she and her. And again, just so excited to be here and learn from everybody else on this panel as we go today. A big passion for being here for me. I have a 3-year-old and a 10-month-old. Almost month-old. Goes by fast. And with my first birth, I postpartum had a challenge with both mental health and postpartum depression and physical, both with low back pain and pelvic pain. And it was, as a physical therapist, kind of opened my eyes to some of the missing links and things that we should be doing within the system to help mothers right out the bat and continued on through the postpartum period. So it really ignited my light to learn more, and from the pelvic health realm has just fired up my orthopedic background and treatment style with all my patients. And we'll dive into that a little more on the physical side later, but again, really excited to be here. So thank you.
Thank you for donating your time. You and everyone here, really appreciate it. And last but certainly not least is Michelle Anderson, who is a licensed mental health counselor and is perinatal mental health certified. She's the owner of Mobile Mama Therapy. I love that, by the way. Whatcom County's perinatal mental health specialists located here in Bellingham. Michelle provides counseling to women through their winding journey through motherhood. What a winding journey it is, as well as supervision, consultation, and training related to perinatal mental health throughout the Pacific Northwest. Michelle, welcome.
Thank you so much for having me. And that perinatal word, it gets everyone, and we're trying to work around that. Becky hears me in that. So yeah, I think thinking into Mobile Mama and what brought me here, which is sort of what I've created lively around, right? Like the intersection of motherhood and mental health, is that after my 3rd child, so I have a 19, 15, and 9-year-old. So after my 3rd one, I was thinking like my midwife came to the house, the lactation consultant, the nurse, like all these people to the house, but where's my therapist? I really need a therapist. And I recognized that I just didn't need a therapist like to work through some big diagnostic pieces. I just really needed support and understanding in this like tender time, which felt unique to the other parts of my life each time, like every kid. And then I kind of took a break. As a family, we traveled around the country for a year, and I checked in with all of my mom friends, old friends, family, relatives, couples, and just said, like, is this a thing for you? Do you think this period of time could use its own sort of support and scaffolding? And there's just like so much affirmation, right? There's the clinical anxiety and depression, but there's also just attachment and adjustment and parenting and relationship and sex and intimacy and ego and like identity and all of these pieces that felt like it needed its own space in its own container. And so when I landed back in Bellingham in 2014, Mobile Mama was born. And it was clearly like such an important niche, like Elizabeth was saying, that just so many providers are, referring to, and basically their moms need support. And this is a really beautiful opportunity for us to revisit that as a community and touch on some of the topics that we talk about all the time in therapy. So thank you so much for giving me the opportunity to be here.
And like, what a visionary, because I mean, especially right now, it's like we're learning that people need to access, counseling and therapy through the pandemic, right? Like through video or through on the phone, like wherever they're at, and not to go in somewhere. And that actually that has opened up a whole new world of accessibility to folks, that at least for me, that's been my experience as a mom. I've been able to show up at meetings and go to things and arrive in spaces online that I probably wouldn't have made it to previously in some ways, just because of logistical time constraints, being a full-time working mother of three. So thank you all so much.
I was just going to say, initially the mobile component was that to remove the obstacles, but telehealth I think has done that for all of us and for mamas in general, just to sometimes it's hard enough to get out of the house with 2 shoes that match, right? So if we can just use telehealth, then that's better.
Yeah. I mean, in person is better than online. I will say that.
I will say that.
Sharing physical space is like so precious. Well, yeah. Again, thanks everyone for being here, and let's dive into our formatted questions. So our first question is, how do you understand sex and mental health to be connected? And what does that mean for moms specifically? And maybe I'll start with Becky. What are your thoughts on that one?
Michelle and I were trying to bet. We're like, who's she gonna pick first? I hope it's not me.
Oh no!
No, I'm just kidding. No, I'm just kidding. It's funny because again, when you sit in something, often it's sort of you got to pull back and be like, well, what is this really? What is this perspective? And what do I want to share on this? And I think, the question is, how on earth could they not be connected, right? They just slam into each other. And one of the things that we talk about so often at the Village Circle is how, there's this like, we do these things pre-baby, we do these things pre-kid, and often we have this, BC, before child times, and then we have we enter this transition into parenthood, and we often discover that we can't access the things we used to be able to access because we're in the new territory, or sometimes we learn that like the things that were toxic we can't avoid anymore. We thought maybe we'd mastered them. And, to me, our narrative, what I see again and again with the women I work with, certainly in my own personal life, is our narrative around sex is so limited. And because that narrative around how we experience sex and how we talk about or not talk about arousal or desire and what does it mean in our relationships, it's almost like once we get to parenthood, we've sort of figured out how to like maneuver through some of these like choppy waters that maybe aren't so great. And then everything just gets laid bare in parenthood. And one of the works that's influenced me the most, and I remember reading it and then leading a village circle group and being like, oh my gosh, this is motherhood, is Emily Nagoski's work on stress and sex. And it's like, well, of course none of us want to have sex. Parenthood is like a never ending stress response. It's like you're just constantly alert, and right, because you're just putting out fires and you're doing this, and where's there space for sex in there? And so there's so much that impacts how we feel emotionally and mentally, because we're just, as mothers, we just get literally just, I feel like all those things we've put up around ourselves, we just get laid bare. And that's where that huge level of vulnerability comes in. But it's also then where we have to reorient ourselves. And if the narrative we come from around sex is really limited, there is no place to go. And there's no room to change. And so one of the things I love to connect is to help women see that connection of, oh yeah, if I'm feeling stressed and anxious all the time, or I'm feeling down and depressed, or I have a lot of harsh self-criticism about myself, right? It's all so interwoven. It's hard to access that place. And sex isn't something, or arousal isn't something that just turns on, right? It's actually an expression and experience. And that's one of the things I love doing. Because I get a lot of women who will say, well, this is a very common thing is, oh, I just don't have any sex drive. I don't know what's wrong with my sex drive. And it's because the container to hold them is like that big, right? And motherhood is like, ooh, it's huge. And so to me, those connections and understanding how we're actually feeling in our body, how that does or doesn't lend itself to maintaining our sexual relationships, whatever that looks like to us. Whether for some women, when they like aren't happy with the fact that, well, okay, so I'm so stressed out, but how do I change the stress? Because I do actually want to have sex more. And some people might say, well, I'm so stressed out, but I don't really want to have sex. And so it's this sort of navigating some of that. And anyway, so I see them as just like, especially in parenthood, just ramming into each other at this big point of eruption in our lives, which is why it can feel so earth-shattering and so just unnerving to not know where to turn to. And you had body changes in there and all sorts of stuff. And I'm going to leave room for other people to speak. Thanks for asking me first.
I mean, it's just a little question.
Yeah.
Yeah, others' responses. What do y'all think?
I'm happy to jump in. Yeah, Becky, I love everything you said, really resonates. Just that recognition of, sex being one of the many places that maybe we had a certain practice with, or we had a certain familiarity with. And then there's this huge transition into parenthood. And I think, what you're saying about how all these things shift and change. And I think it makes it harder that most of the people I listen to and speak with don't expect this area of their life to change. When they start to see issues and we start to make connections to it, it's almost like kind of obvious, like, well, yeah, like my body changed, my heart has changed, the things I think about have changed, my relationship with my partner has changed, my schedule has changed, and it's like, of course, sex is going to change, but there really often is, I think, for people, a real disconnect, or just a really missing piece of support and information going into parenthood, whether that be you are the person who was pregnant and gave birth, or whether you are the partner of a person who gave birth, or whether you have adopted a child or come into parenting another way. There's a real lack of really any discussion in our culture, and not just culture as a whole, but in healthcare, and in terms of what friends talk about, even what's generally acknowledged is, yeah, sex is going to change. And I think sometimes the challenges that people experience postpartum with sex, if there had been more education or more support or more recognition of some of the more common changes or things that can happen, it might not have even been a struggle postpartum. That's not going to be the case for everyone, obviously, because there really is no normal in terms of how you feel postpartum. There's such variety, but yeah, I tend to see things from a kind of systemic perspective a lot in my work, and that gap of connection, you know, even asking the question, how does sex and mental health connect? A lot of people would say, oh, I know there's a connection there, but maybe I've never been asked that, or I've never really thought about that connection. The other piece that comes to my mind that feels really imperative is the mind body connection. You know, so I think for some people, maybe pre-parenthood, especially for those that give birth, you know, maybe sex, what they realize is that when they had sex, they weren't really actually connected to their body. That even, you know, whether it was because of trauma or whether it was just because of their relationship to their body or the way they were taught about sex, there can be kind of a little bit of a disconnect, which, you know, sounds funny because when you're having sex, you're usually using your body, but I think we all are resonating with what that actually means. Like, yeah, I'm just not really in my body. And then all of a sudden, especially, like I said, for those of us who gave birth, you're forced to be in your body in this very real way. And it can be kind of jarring. I often wonder too about the large number of people who experience pelvic pain after giving birth. And in a lot of cases, they've been, you know, they've seen their medical doctor, their provider, and they've said, you're healed. You're ready to go have sex, like nothing is wrong. And yet they're experiencing this extreme pain. And I often wonder if a big part of it is just that foundational, like all of a sudden I'm in my body and I'm recognizing some of the things that I'm doing or that are happening to my body don't actually feel good. So there's a lot more there to talk about, but that feels like kind of an additional, yeah, and Caitlin's laughing. Yeah, I'm really interested to hear the PT perspective there, but yeah, I think I'll stop there.
Yeah, thank you. I wonder, Caitlin, with your snaps and your claps over there, if you might have something to add.
Absolutely. Thank you, Elizabeth. You touched on some great things, both of you, Becky. But just going back to the question, I think that sexual wellness is a part of our overall wellness. And motherhood just opens that door to this area, for me, known as the pelvic floor, pelvic bowl, that let's say you're carrying a baby, you have a baby, and before that you had this much awareness. And then you had the baby and whoa, hello. And now you have all these potential new issues or feelings or lack of feelings. And that's a huge piece of it. But there's this small infant that you have to care for all day. Or there's a partner, or there's other children you have to care for all day. And that's where your attention goes. That's where it goes. And we forget to take that time for our wellness. And our wellness, be that mental, be that physical, just going on a walk, is going to help lead back to that sexual wellness. But a lot of our patients come in with complaints of pain. Maybe they say pelvic pain, maybe they say back pain, and they don't even say they have pain with intercourse or attempted intercourse. So we ask, and they say, oh yeah, I do. And that becomes an open door to a lot bigger conversation that may need referral to counseling or a sex therapist, because their friends, it's normal for them to be painful. For their friends, it's normal to have leakage. It's normal. What this standard of normal is should not be considered normal. And I just want to preach that we are here to help with any symptoms in your body or your mind that don't feel normal. We're here for that. And there's not this imaginary line of 6 weeks, ready, set, go. It's individual. Everyone is individual, and everyone that walks in through our doors or on a telehealth appointment, we have to get to know that person and meet them where they're at, because everyone has their own experiences. So here I go rambling too. There's so much more, but and we'll get into maybe the physical side of it a little bit more later. But I think addressing and just asking your provider, maybe it's 3 weeks out, maybe it's 6 months out from a postpartum as a parent or someone that delivered, maybe it's 10 years out. It's never too late to seek out and get education for what you may be feeling. I'll stop there.
I would love to just touch a point that we didn't address quite yet, but as far as like in my brain and in my practice, I think one of the intersections between mental health and sex is sleep, right? And I feel like we can all most likely as mothers and parents recognize that the ridiculous lack of sleep in leading up to pregnancy and in the postpartum period for some women for a really long time affects our mental health significantly and absolutely affects life around sex and intimacy. I'm sorry, you're going to hear my dog bark for 1 second. And so I think when we address this directly, we're all talking a little bit about basic needs, like our physical health and our emotional health. But when our basic needs aren't going to be met, like for a lot of the moms that I work with, sex isn't part of the basic needs. Like that might not be true for the partners, but it's totally true for a lot of the moms. And so a lot of the work has to do with getting our physical and our emotional mental health basic needs met, and then there's a little bit of capacity, and then when there's capacity for sex, it's like a whole bunch of material around intimacy, around our ideas about sex and motherhood that we created when we're tiny, right? Like when you see images of on TV or in our culture, like what are we supposed to be and how are we supposed to act? And I think at each stage through conception and the postpartum period, all the way through motherhood, really, that keeps transforming. And I think that's important for women and moms to know is like, this is a temporary stage. And this temporary stage is like a week. The first week postpartum looks a lot different than the third week, third month, third year, and 30th year, right? Like, so it's not stuck and it's not fixed. And just like Caitlin was saying, like, it's never too late. Like there's always room to access support and help and to work through if sex and or any of these issues are coming up through motherhood, like there's so much room and space to work through it, and it could feel different. And the last thing I think that will connect with some future questions are often when sex is coming up in session and there's this like should around it, like I feel like I should be engaging at this point because I'm cleared at 6 weeks, or because like we haven't had sex in 3 months or 9 months or whatever it is, right? I get more curious about how to create intimacy in the relationship and how those basic needs can be met. Because I think when we feel supported, right, we're more likely to relax enough to connect and feel engaged with our partner in a different way. So like really developing those strategies and techniques of creating intimacy and safety and connection it goes a long way into regaining a new awareness around sex at whatever stage you're at.
Can I throw one more thing in that Michelle just made me think about? And that's really calling out that, before we become a parent, we have this role that we use with our partner, and that can take lots of different shapes, but we have this part of our relationship that is our lover, our intimate relationship. And then we shift into having these intimate relationships with our young new beings in our life. And what can be so challenging, and when you're all alone in your house, right? Parenting is just so isolating. It's easy to sort of lose track of the perspective, but that it's really hard often to get out of mom mode. And even though we can see our partner in the flesh, we can see them, we can touch them, we can feel them, sometimes we forget that we actually have to get in a different mental space to engage with them as our lover, right? Because if we're like packing the diaper bag and thinking about mom stuff, like we don't want to have sex with our kid. And it seems silly, but like our partners, without us even knowing it, can just blend into this role that we've just, we take on. And there's so little reflection on these parts in our culture, again, because our narrative is it's so narrow, it's so limited, and there's so much toxicity in it that I just remember, and again, thinking at a village circle group, just being like, if we can actually be like, oh, I actually would want to have sex with my husband, but I have to be Becky to have sex with my husband. I can't be mama to have sex with my husband. If I'm mama, I don't want to have sex with my husband because I'm mama. Then who is he? And again, I recognize this is a really heteronormative example there that I just gave. But that I think, again, just creating some space to realize that it's everything in our culture tells us we're just the same and we just keep doing the same things. And we are not. We're at like an explosive point of changing in our relationships and our personalities, and that we get this wonderful chance to have this forced growth and to start new intimate attachments and relationships with our kids. And then we got to figure out how to take those and look at our partners in these other ways. And I felt like I was having an affair with my first child. I co-slept with her, she had my breast in her mouth all night. Like, another thing about the bed and sleep is like, we need to prioritize sleep, but the bed is also where sex often happens. So that's a really important intersection that our bodies feel, right? We get in bed and we're too tired, but we know our partner's right there. So anyway, I could go on and on, but lots more examples there.
Go ahead, Elizabeth. You have something to respond to that?
Oh, no, I think I'm keeping myself unmuted at this point.
Oh, yeah. Sorry about that. No, please jump in.
Yes.
Yes. I know. I'm kind of curious, I'm thinking a lot about that. Our next question is related anyway to sort of what are some typical challenges that come up for folks that you serve or work with. But also just, I'm especially curious about that idea of the should, of the scripts, of the narratives. They're so limited for women. They're even more limited, I feel like, for mothers, and then even more limited probably for elders and grandmothers. And yeah, so I'm just curious about how those show up and what are those scripts and how do we work to combat those, or how do we be our most authentic selves when those do come up? I'm just kind of curious about that. And maybe Elizabeth, you might have something to say about that.
Sure. Yeah, I can talk a little bit about, specifically the sexual scripts that we learn. And, maybe I'll talk for a second about what is really, targeted towards cis hetero people, but that everyone is exposed to in terms of media and most of the systems of sex education in our culture, which is this very narrow, very specific, very goal-oriented view of what sex is. We're talking about sex and motherhood, and sex in and of itself has so many different meanings. But the one view of it, the one script, the one example of it that most of us are taught is penis in vagina sex, penetrative intercourse, right? And it's so pervasive. And it's not just penetrative sex, it's penetrative sex that, maybe starts with a little bit of foreplay, which in and of itself is a problematic word, because it insinuates that anything that happens before penetration is just a lead up. And then, there's maybe like a certain amount of time where penetration happens that feels acceptable. And then, if you have a more equitable relationship, maybe there's an assumption that both people will have an orgasm. But in a lot of cases, the end of sex is when, in this case, the cis male partner ejaculates, right? So that is such a pervasive image and model of sex that we're taught. And then there's all these different nuances within it, and a lot of them have to do with our bodies and gender. And so again, for the message towards specifically cis women, and again, everyone's receiving these messages, but is that, we still have a very puritanical view of sex. So a lot of times cis women are taught that we are really more in the receiving or like responding role, both physically and kind of emotionally and energetically, where the cis male is the one who actually like wants and enjoys and proactively has sex. Now, even if this isn't your lived experience with your partner, these messages, again, they're pervasive and they seep in. And so that particular script, I think, is, I mean, when I see clients, again, like I said, I see clients at all different stages of life. That is almost always something that we talk about really early on, is like, what have you learned about what sex is and what it looks like, and how does that show up, regardless of what your gender is, regardless of what your body looks like or how you use it. And it's so limiting. And so one of the kind of wonderful things about people who are entering parenthood, and especially people who've given birth, who are examining this limited script of sex, is that in some very tangible ways, they're really being forced to acknowledge, oh, not only can I not really have sex that way anymore because it hurts, or because I'm too tired, or it takes too much energy, but actually, and this is where I try to help them get to, actually, I don't want to have sex like that anymore. And a lot of times, especially in the case of hetero couples, when I'm working with a cis female who's just given birth, she's often worried more about what her partner is going to think or how her partner is going to respond. And what I like to share with people is that, at least in my experience, the vast majority of partners are so on board with making changes where, in this case, she is going to enjoy sex, where she is actually going to want sex. So actually helping, and if I happen to be lucky enough to work with partners as well, helping both of them just totally shift their script about what sex is. And yes, we're using this incredible transitional stage of parenting to do it, but it's something that really is beneficial at any stage of life. It's just, there's something about that parenting transition, which I think really forces a lot of people to say, oh yeah, we can't, like this whole thing where we have a whole dance, like I see the look in your eye, and then you touch me here, and then we lay on the bed, and it's like a couple minutes of that, and then there's like 2 minutes of thrusting, and we only do it, we do it at the end of the day. Most people who've been together a long time, they have a set script, and sometimes they're like, I like it, but when you get to the point, like Michelle was saying, well, like all of us were saying, where all these things stack up, you're exhausted, you have this new relationship, right? Becky, you're talking about it almost being like an affair. I've talked about it too, using that poly term, like new relationship energy. I mean, it's not just the physical closeness. I mean, hormonally, you are just like bonded and synced with this little human being. And so to expect to be able to shift back into that previous sexual script, for a lot of people, can be really hard. So I think finding ways of like, okay, if I'm packing the diaper bag, maybe like thinking about shifting right away into that old sexual script we had, I can't do that. But, I'm packing the diaper bag, and, to my partner, you come up behind me and you rub my shoulders and you ask me if I want to go sit down, and that you're going to finish packing the diaper bag and I can lay down and, have a few minutes of rest. And then you come and rub my feet, and then maybe we start moving into something a little more sexy, right? But the whole idea of like, you're going to look at me and then we're going to move to the bedroom and do that all same thing. Oh, that sounds awful. I don't want to do that. So yeah, again, I'll maybe pause.
I mean, I'm getting turned on right now. You talk about somebody coming around offering to pack the diaper bag. I'm like, yeah, honey.
Yeah, it's just
Ah.
your needs change, but it's also not just like, oh, you're a mom now, so of course all you want is a foot rub. I mean,
Yeah.
like moms like to get
Course.
fucked
Yeah.
too.
Yeah.
Like, I hope
Right.
that's okay to say here, but like, you know, some moms like want to be fucked. It's not
Yeah.
just like, you know, foot rubs and a glass of wine, but that attunement and recognizing that, yeah, there's gonna be a lot of moments where I need something different, and that can actually be really good for
Yeah.
everyone.
Yeah. For
Yeah.
sure. Thank you so much. Yeah, I'm thinking also about like, you know, sex as a healing tool, like something that can help your mental health also. It's not always like the thing that we can't do or that we're not doing what we feel as well or right, you know, because we're experiencing anxiety or, you know, we're tired or like our body is still healing or all those things. Like it also can be something that can support our mental health and wellness when we are in a place to, you know, identify and ask for what we need, or even to masturbate and to pleasure ourselves and to give ourselves that gift and investment in our wellness. um so some of this is coming up naturally, but would love to hear more about examples or stories of some typical, you know, common experiences or challenges that your clients or the people that you serve experience. And maybe I'm wondering if we could start with Caitlin this time, just kind of on the physical aspect, and probably Becky too. I know that you do medical support as well. So
Perfect. Okay, so some sex-related challenges from a musculoskeletal perspective. Often we see postpartum mothers come in with, I'll kind of narrow it down to like pain or weakness, and that can come from many different places. So we're assessing tissue, and is that related to the scar from a tear? Is that from a C-section? How does that make you feel confidence-wise? It's painful, maybe even to wear pants. And orthopedically, we look at the back and the hips and know that some hip dysfunction can drive some pelvic dysfunction. But all of this ties into like a holistic approach. And I have an example of a mother, first-time mother, postpartum, with a vaginal delivery and tear, and she was experiencing pelvic pain. And she had a history of neck and shoulder pain, which can be exacerbated with new mom breastfeeding. She had some previous anxiety and was currently seeing a counselor. And so, of course, we educate. First, we educate, say, this, what you're experiencing, we can help with. We talk about the anatomy. We talk about what happens when tissue heals, what happens when scars form, what we can do to help. So for her, it actually started with breathing techniques, getting a sense of being comfortable in her body. Because we know with her neck and shoulder discomfort, she was tensing her glottis, her neck. And when we tense here, we tense our pelvic floor. That goes into sex positions where if we're nervous about sex, if we're anticipating pain, what do? Hold our breath, maybe tense everything, and then sex isn't going to be as pleasurable that way. So for her, we started with breathing. And then we started with biofeedback, which are sensors we can place around the pelvic floor and give her this newfound awareness of these are what my muscles can do. These are what happen when I contract. Can I relax my muscles when I want them to? Can I stretch those muscles when I want them to? And that's huge. A lot of people don't know how to do that. We need to be able to stretch with, and that should happen with different types of intercourse. And by the time we taught her to down regulate her nervous system, get her in tune with her pelvic floor, we were able to work on some scar tissue around her pelvic floor and introduce that with her partner. And that became a supportive exercise at home for them to work on. And for her, it was great because she was aware that her pelvic tension, when she released her pelvic tension, her neck felt better, her shoulders felt better, this whole kind of systemic relief. And so by the end, she was having pain-free intimacy with her partner. And then we into lifting, and we transitioned to running, and now she's coming back and saying, I want baby number 2, let's talk about what that means, which is great. But again, it's this whole cycle of can mean different things. Where is this patient at? We don't always, from a physical therapy standpoint, we don't, some say pelvic health PT, you're just going to work on my pelvis, right? No, we work on all of it. So, and ideally get partner involved too, which can be in a different form of, maybe that's sexy. Maybe you supporting me in that realm and communicating with you about that, maybe that's sexy. And that can help with the arousal and desire as well. So there's one example.
Yeah, thank you so much for that. Anyone else want to share, common concerns or challenges or a story?
Yeah, I think it's important to recognize that we kind of touched on it, no pun intended, before, but giving birth, if there's a history of sexual trauma, if it's conscious or unconscious, if we're aware of it or not, giving birth can sort of elicit that response, right? And or breastfeeding. And so for some women that we work with, their body, they're expecting, maternal bliss, and their body goes into fight or flight, right? They are like fully limbic. And so concurrently, like we were talking about before, they're having to care for their own healing, care for this infant, and then they have these like their partner who they have ideas of what the partner might need or want to, real or imagined, it doesn't matter. And so a lot, and I was sharing with Liz, I think initially, one story of a client, which is kind of common, is just that after she gave birth, she would not let partner in to the bubble. He was not at all part of the historic trauma, but like her nervous system went into fight or flight and protect, right? And so and then she was trying to override that because the shoulds are like, he's a good guy, like he should be part of this, and like I need help and I need to sleep, and like but her system couldn't override that, it was too big. And so the very first part of that is just saying like, yes, like your system is talking, like let's just hear and get the map of what's happening. That is so real and so important, right? And there's no time frame of when you need to expand your bubble to include him, right? Or when you need to be intimate or lean on somebody or not lean on somebody. Of course, in my mind, I'm like, I want you to have the support you need, but there's no timeline and there's no specific way to do it. So there's just like, so I guess what I'm saying is, often giving birth, pregnancy and giving birth, or even trying for conception, giving birth and pregnancy, is a window into our body's story. And it might be a story that we haven't listened to or remembered. And then there it is, right when the baby's there too, right? And so there's a lot of work that we need to do sometimes that intersects with sex and intimacy and body image and safety and trust. And that is really beautiful and very painful and sometimes very ill-timed, right? Because there's like you're tired and you have all this stuff but and then another part of it too, I think that's important, that Elizabeth touched on too, is like we have these ideas often what the partner thinks or needs or wants, and there's like a lack of communication there. But often 99%, I think there was like one time that this wasn't the case, but when we invite the partner in and really lay out the terrain, there's this softening of like, yes, like how can I do that? How can I meet you there? What can I do? And there's probably like some reminders along the way, right? But there's this like openness and genuine, of course, like how I want to be your ally in this, and I need to learn how to do that. I don't know the language, but that can be true for this kind of healing journey around trauma, but it can also be true around having an idea about how they can support the mom, like akin to packing the diaper bag and, you know, making the lunch, or communicating through sex. Like, actually, that doesn't feel good. It takes clients sometimes many sessions to really identify, oh, I actually don't talk much during sex. And like, that's terrifying. Or like, I don't know how I feel, or like, I just want to get through it, right? So just doing some exploration around, well, what do you know? And what do you know during the day? Do you know when you're hungry? Do you know when you have to pee? Do you know that you need to take a right and not a left? Like, let's hang out there. And then why don't we slowly bring those experiments a little bit closer to home? Do you know what you need to eat tonight? Do you know whatever, right? And then, oh, do you know, without saying anything, but do you know how that feels in your body? You don't have to tell them, but I want you to just like know. And then what if you did tell them? Like, where would we start? Would we start with the cues in the living room? Or can you start, in the bedroom or in the bathtub or whatever's going on, right? So giving permission to, and these tiny little experiments to start identifying, how do I feel? What would I say if I did say something? And then easing those experiments and maybe letting the person into those experiments too. Like, I might tell you how I feel later. So they're like ready for it, right? And then they can ask you, but without any pressure. So just building self-awareness and self-regulation and communication strategies. And allowing, if the trauma response comes up, like, that is perfectly appropriate and okay, and it makes sense, to making room for it and not trying to override it, which might have been the strategy through a lifetime.
Yeah, thank you so much for that, Michelle. Becky, I'll let you respond to, and then I have a question that is kind of related to that, that I'll share next.
Yeah,
so go ahead.
I guess I just wanted to add, one of the things I see most commonly is, and it's interesting because Liz, you touched on it. Elizabeth, you touched on it. Sorry, Liz and Elizabeth, my brain went. Is that it's sort of this funny, and I feel like there's so many sort of paradoxes, or right, there's 360 degrees of things. I often talk about that with the women I work with, both in my office and in group, is like, there's a dark side and a light side. And so I think it is interesting that there's, especially, I mean, and I see it with really actually any type of baby that's been pulled out of our body, whether through our vaginas or through our low abdomens, is, like it or not, we are more in our body suddenly. And a lot of us don't really know what to do with all the signals. And we don't also know what to do with all the changes in our body. So I would also like to call out the context around, just our unfortunate toxic body shame culture. And so our own ideas about beauty and sexiness and what we're supposed to look like and how our body's supposed to feel, just like so many things I've said already, I feel like there's just this explosion that, like, we don't really have the time, the energy, or the context to deal with, because for most of us, we've compartmentalized, we've figured out how to move through our body, and then now we feel all these things. And sometimes I find what I notice is almost like a preferential numbing, or a sort of choice of like, well, I can't feel all this stuff, so I'm not going to respond or feel to anything. Partly due to the stress and the steep learning curve of being a parent. But I find that, trying to engage women in those opportunities to feel and to acknowledge and to be present, whether through counseling, through PT, even in the exams that I do, and help and just allowing them to be present in their body in doing like an IUD insertion postpartum, right? I hear this all the time of like, well, I just gave birth. I mean, it can't be that bad, right? But giving them a chance to be present through something with their body, I just find that really interesting to me, that they simultaneously feel like suddenly have to feel all these different things because their body's been literally opened up. and I really want to honor that discord, that sometimes what you're feeling, you don't want to feel. And so we can compartmentalize it or we can ignore it. And I see a lot of women later on then suffering because they didn't have an opportunity. They didn't have anybody to go to say, I'm kind of feeling this way or I'm feeling that way. And we are lucky in Whatcom County. We have so many great resources, and there is such an opportunity for there to be a therapeutic experience to learn your body as it's changed, and so much opportunity for positive growth in that way. Thanks.
Yeah, absolutely. And Becky, actually, a question came in that said specifically, I'd love to hear more about the body image and about our culture's expectations and how we can begin to break that down in our minds. So I appreciate that you brought that up. I'm wondering if anybody has any tools or ideas for how to break that down in our minds and hearts. It has been deeply embedded into some of our psyches and bodies and selves. So yeah, any tools and tricks related to doing that work?
Well, I have like an anti-tool.
I don't know what that means, but I'm looking forward to hearing about it.
The anti-tool is to disengage in social media. Like really be thoughtful of what you're ingesting and media, right? Or even friends, but just be really thoughtful of what you're ingesting, especially during this period of time that's going to reinforce images and beliefs and scripts that are not accurate to your experience and or to your family or whatever that is. And I think that that's really intentional. And I know social media and media in general is like addictive. And so there's some strategies around that. I actually just wrote a blog about it. You can find that on my website. But just simple, like doing a little experiment of if you're not in the soup, if we bring that back from Becky before, if you're not in the soup for like a week, 3 weeks, a month, just notice how that feels. And if that feels different, then maybe get more curious about that. Like, how can I still stay connected with news and family in a way that feels more nourishing to the sense of self that I'm developing, or my ideas about my body or my family or my parenting strategies or whatever that is. So that's the anti-tool.
I feel like that's still a tool. I like it. What are we consuming? Yeah. Go ahead, Becky.
I was gonna say, what two of the things that come to my mind are not, I do not own them. They come, I can't recommend Emily Nagoski's work more. But there are two tools that came out of her book, her most recent book called Burnout. And one of them is this, is just this simple phrase. This is the new hotness. And I don't want to spoil the whole book, but I'm going to definitely call it out. It's a great audiobook. But the other thing is being able to recognize when we're judging other people, because we often reframe that's coming from a place of self-criticism as well. And one of the exercises that Emily talks about in her book is actually going through images of women of all different colors, sizes, ages, and saying to each picture, she is beautiful, and or they are beautiful, if we want to use non-binary terms, they are beautiful. And I know that myself as a new mom, now almost 12 years ago, I was totally back in 6th grade looking at everybody's like, are they still in maternity pants? Are they not? And without even trying to. And now, I grew up in in the same toxic rain that we all get, right, around body shaming. And I consciously make the choice when I see someone and I can feel even those things come up. I'm not conscious of them. I'm not choosing, but they're there because I was made in this culture. I counter it with, damn, she's beautiful. And I can feel a shift in my body, and it's not really about the person. I'm actually feeling a shift that like, oh, I don't actually care about how my pants feel because damn, I'm beautiful. And so I find that active engagement in sharing what we view as beautiful and good to other people, it instantly flips around to share to ourselves too.
Yeah, I might add, just keep adding on a little bit. There actually is an Instagram account that I follow called Beauty Redefined, and I'm really not very good at remembering names, so I can't remember the name of the two women. They're twin sisters that run this account. But their whole motto is that your body is not an ornament, it's an instrument. So their whole messaging is in some ways counter to some of the body positivity movements where the intention is like loving your body no matter what. Or you know, I mean, you were kind of saying, Becky, like, you know, shifting your definition of beautiful, which I think, or like your awareness of beautiful, which I think can be really powerful. And then this other layer of trying to have a relationship with your body that isn't about beauty, that isn't about the way that you look. And especially for people who are pregnant and give birth, that can be a really powerful moment to make that shift. And because in a very real way, your body really was an instrument. I mean, your body, what was happening was very much not about how it looked, but what it was doing and what it was capable of. And I would say even for parents who didn't give birth, you know, your relationship with your body and the comfort you bring to your child and the way that you hold them and the way that you model what it is to move and live in a body. I mean, there's so many pieces about it that I think in that transition to parenthood that can make it a little bit easier to access that concept. And I think, you know, that's especially hard. We keep touching back on this recognition that, you know, this transition into parenthood, especially for people who give birth, your history comes up. I mean, it shows up, and it can be stuff that you were conscious of before, and sometimes it's stuff that you weren't necessarily conscious of. And there's even, you know, a perspective to say that it's not just your history coming up, that there's an intergenerational experience coming up as you are basically creating another generation in your family. Not to mention, and this is also related to body, but what was, for people who were pregnant and gave birth, what was your experience of conception like and your relationship to your body there? You know, for people who struggle with infertility, there can be an extreme rupture in maybe they had a more positive or even neutral or slightly negative relationship to their body, and then you experience any struggle with infertility, and there can be a real deepening into a sense of frustration. And even people who come out of infertility and end up, you know, getting pregnant and giving birth, there can be a real fear around, will my body let me down? Or anyone who's experienced a pregnancy loss, you know, whether it was a miscarriage or later on in the pregnancy, or, you know, any kind of loss is going to show up. I feel like we could spend just hours talking about that piece. So I think there is a real unique individual experience that can happen in recognizing that your history on so many levels, that, you know, from your family, from your childhood, from, you know, what it was like to actually be in a space of deciding to have kids. Did you actually decide to have a kid? You know, I mean, like, what was that like, and how did that shift your relationship with your body, but also just your experience of being a parent? Did you actually choose it, right? So I guess I don't want to get too far out in the weeds to kind of reference back to the original question around resources. I think for me, a big one is just like how I spoke about really kind of like breaking open this script for sex. You know, it also holds in terms of relationship with yourself, and that includes your physical body. In looking at, you know, I hold an encouragement for, you know, I'm not here to tell you you need to feel good about your body. Like, sometimes the body positivity movement, I think, can be not problematic, but ineffective in that way, where some people then feel additional shame, where they're like, you're telling me I should love my body, but I don't. And now I'm ashamed of that. Or, is something wrong with me because I don't feel that way? So I might even, introduce the idea of being body neutral. Like, what if you had a day where you didn't even think about how your body looked? Like, what if you had a day where, kind of like Michelle was talking about, like you had an experience where it was more about how you felt, and something I might encourage is getting rid of mirrors, blocking them out. Like, yeah, maybe if you use your phone or your computer, like really not having any access to seeing your reflection just for a day. When you're putting on clothes in the morning, instead of what they look like, like blindfold yourself and see just what it feels like in your clothes. So little interventions with that foundational support of really changing the relationship to the body. And if that doesn't fit, that's okay too. If someone is like, I want to feel good about my body, I want to love my body, especially as it connects to your relationship with sex, right? Like, I want to be feeling confident when I go into a sexual situation. I'm going to honor that. I'm going to help them, but I'm still going to always hold that, priority, if you will, of how you feel during sex, of shifting from what for some people is more of a performance. And again, this kind of goes back to that general male female script of like, women are there to be looked at and seen and viewed. And so how can we shift that to where, like, it doesn't matter what you look like, and I guarantee your partner's not going to care if you're actually into it. Can we focus instead on what you feel in that moment?
I love all these recommendations. Where do I start? I think one tool, if you aren't listening to You Are Not Broken with Dr. Kelly Casperson, who's local, highly recommend. She's just affirming knowledge for human beings, all genders, all ages, all arousal, desire levels, and just, I would definitely recommend that and listen to that. From a body image, man, do we see that day to day from especially social media. Moms come in and I need to get my body back. I need to get my body back to where it was. Well, let's talk about that. What does that mean? What does that align with your goals? Well, I found this body back postpartum exercise program online and they're doing 25 push-ups and well, let's watch you do a push-up. Let's start here. There's that pressure. There's that pressure to do what other people do again, and not listen to our bodies. Maybe that's having more self-love. Maybe that's being more neutral, but just being aware and stepping back and saying, what does my body need? Maybe it needs a walk. Maybe I can do a hike and hike feels good, but stepping away from the pressures of what other people are telling me where I need to be at and listening to that. There is another recommendation or tool. If you're comfortable with it, it has a lot more anatomy based for the postpartum. And it's by a PT, a physical therapist, Kathy Wallace. It's called Reviving Your Sex Life After Childbirth. And it just goes through some steps to try at home and some things to work through. And then if you're still having some difficulty or challenges, to reach out for help. But that's another recommendation as well.
Thank you for those, Caitlin. I think what I'm going to do is move to some of our questions now, and really want to recognize that some of these questions are complicated, and so we may not get to all of them. But I would love to, after our event, if folks could help respond to some of these questions, maybe write them out, or we could make little videos or something. I think that would be a really cool way to get some of these folks that are participating supported. So many of these questions relate to the topics that we've been discussing already. So one attendee shared, there's been some discussion about this idea of getting a pre-baby sex life back, kind of related, Caitlin, to the pre-baby body, right? But I'm wondering if anyone has some advice for those of us whose sex life was already subpar before motherhood. That is, what if the pre-baby bar was already low? Any advice for that participant?
I would just offer, this is kind of my whole approach here is, even if, whether it's someone who's like, yeah, I want to get back to where I was because it was good, or like this person is saying if their sex life was subpar, in either case, what I encourage is thinking of this as something new, starting a new kind of sexual relationship. Like I said, when you transition into parenthood, everything has changed. I mean, so much has changed. And like amount of sleep you're getting, probably what you're eating, the way your body feels, your relationship, everything has changed. So sex is going to change too. And I think acknowledging it, and in this case, especially if you're reflecting on like, I don't want to get back to our previous sex life, really embracing this idea of it. What a really great opportunity to approach this as something new. And if you want to utilize it as a reason or an excuse or a moment to say, I want to do things differently, I think it's a great moment to do that. And I think there's never, just like I think Caitlin was saying about getting support, there's never a wrong time. Like it's never too late. I would say the same goes for getting more education, and talking about new things. I mean, I honestly, most of the long-term relationships that I know in my personal life and professionally where sex is still satisfying, the partners would say that really we've had many different relationships in that one relationship, if that makes sense, meaning that they're changing in all aspects of the relationship, but sex is included. That their sex life is not the same as it was when they were in their 20s. It's not the same as it was before baby. It's not the same as it was right after baby. It's not the same, So I actually think that that's not bad news to say that, pre-baby it wasn't very good or it was subpar, to use that as a way to think of it as something new.
And as an opportunity to exert some agency and some autonomy, right? And to get curious about, does it feel subpar because it's not like it doesn't fit for me, it's not what I want, or is it subpar? To get curious, is it subpar compared to some unrealistic expectation? And gaining clarity on that is an opportunity to get to know ourselves a little bit better, right? To exert some opinion and say where maybe we, for whatever reason, we got in a pattern where we didn't get to, or maybe we're actually okay hanging out at subpar, right? But it's again, parenthood it's this opportunity for amazing growth. And sometimes it feels forced. And then sometimes we can engage with it by choice. And so I would just really echo what Elizabeth said, and what a great opportunity to get curious, gain clarity, and express our wants and our desires, which unfortunately does get harder as we become parents, but we can really exercise that.
Yeah, thank you for that. Um, the next comment is, for us to jump off from, says, that comment about masturbation reminded me about how there can also be guilt. If we're thinking about how we want sex, but it's hard to engage with our partner, and then sometimes masturbation feels safer, or more pleasurable, etc. But then we feel guilty for not having that physical expression with our partner. Um, Anyone want to comment on that experience of guilt? Yeah, go ahead, Michelle.
I would say that comment, as well as what Elizabeth and Becky were just talking about, just really kind of elicits this opportunity for communication with your partner, right?
Mhm.
Which might feel new and dangerous, unknown, all of these things, but there's all of these unknowns and all of this projection of what they might think, right?
Mhm.
But then you get
Mhm.
to have that conversation, like,
Mhm.
I
Mhm.
have this much energy and masturbation is a really good stress relief for me. I'm going for it. And I
Mhm.
still love you. Or at some point,
Mhm.
we're going to go for it together, right? Or like mutual masturbation, or making time, but to connect in other ways. But really, just the heart of it is like, I think the hardest part isn't engaging in sex or masturbation or whatever. It's actually talking about it. It's
Mhm.
actually saying like,
Mhm.
hey, I have this going on in my mind, and I want to recognize that there can be decades and ancestrally historic levels of guilt and shame around sex and intimacy.
Mhm.
And like,
Mhm.
that is real and big and in the room.
Mhm.
And so it takes a lot of courage to breach the bridge. But what I
Mhm.
say often is that we don't change much unless we're uncomfortable. Really, like, I think discomfort, it doesn't have to be excessive, but just even a little bit is motivational, right? So there's this a little bit of discomfort, like either I want to create some more intimacy to make our sex life less apart, or like more enjoyable, or more connective, or like more intimate, right?
Mhm.
Or I'm going to masturbate. Like, what do you think about that? Right. So I think
Mhm.
that the discomfort of sitting with the ideas about it can be motivating.
Mhm.
Right. And like, if you're going to be at that point where, no, this is working good enough. And then like, I kind of want to connect with them again.
Mhm.
And it feels like an ocean away.
Mhm.
It's been a long time. How do I start that? Like, building that raft, right? Well, it could be by putting a little sticky note on their lunch as they're heading out the door, like, hey, remember me? or um, or or doing a non-intimate 10-minute on 10-minute just shoulder massage, right? Or like
Mhm.
holding a hand when you're walking, or just saying like, I want to make time after we both put both kids to sleep to
Mhm.
like be in the same bed for 5 minutes tonight. Like, that's my goal. And I don't want to have sex. I just want to be next to you in the bed together for at least 5 minutes. And
Mhm.
that's an invitation, right? And so like, I guess, so starting with the communication, starting with these really sort of mundane, but in the world of parenthood, like, mundane is the deal. Like, that's kind of where we hang out, like the food, water, sleep, exercise, support, like that's where we hang out. And so it's in those ways that we need to connect to help bridge the communication and the intimacy to these other components.
And normalizing how hard that is, right? Because it's so hard to communicate, right? Like, there's such task disbursement, right? It's like all about like allocating tasks in parenthood, right? So to be able to have this, like, to really call out that everyone else is having a really hard time. Nobody else is easily just be like, hey, I'm going to go masturbate, honey. I'll see you later. Right. Like, that's hard for all of us. And just like so much in parenthood, it's so easy for us to feel like we are the only one who can't figure out how to talk to our partner about what we want, what they want, how to do this.
Mhm.
But like all that mundane stuff that Michelle just talked about, we're all doing it. We just
Mhm.
live in such an isolated way that we don't share it. And that's what's, I mean, not to put a plug out for the Village Circle, but that's what's so amazing about the Village Circle is that we can
Mhm.
create a space where we're like, oh, there's the real backdrop. Here's what it's really like. And that can allow us to settle into that discomfort because there's not the fear that we're the only one who's uncomfortable in that situation.
Mhm.
And when we can get rid of fear, we can hang out in discomfort a little bit and we can move
Mhm.
through it. And that's where our growth happens.
Mhm. Mhm. That's so beautiful and so true, Becky. Thanks for sharing that. So I am noticing that it is 3:57. Can you believe it? our time has just flown by. This has been so incredibly rich. I feel so much deep gratitude for each of you coming today, donating your time, engaging in these discussions. There were several questions in there that were talking about communicating with your partner and how to do that, how it's easier to kind of talk with my mama friends about this stuff than it is to translate it into a conversation with my partner. And I think, Michelle, you really spoke to some of that. But I will kind of circle back with the group and the remaining questions that we didn't get to today. I think we touched on pieces of them though. They're related to identity and how do we talk about these things, and how do we not only have our whole conversation related to what the kids are doing with our partners or with our sexual partners. So I think we touched on a lot of it. Again, immense gratitude. I'd like to just offer a moment for each of you to share, like, where can folks find you? There was a question, Michelle, if you have therapy openings specifically, and there was a question, Becky, about the Bellingham Mamas support. I can't remember it all, BHSM or like where that is, what happened. So if you want to just briefly kind of share where people can find you and get connected, that'd be great. Let's start with Caitlin.
Oh, okay. I am at Core Physio, which is an outpatient physical therapy, currently in the Fairhaven location, but we're opening up a larger site at Grant Street. I am not the only pelvic health therapist there. There's about 4 more of us, and we also have outpatient orthopedic therapy there as well. So we support all genders, all ages. So you can find the website Core Physio PT. We're on social media on Instagram and Facebook as well.
And Michelle.
So Mobile Mama Therapy is currently hiring a few more therapists, so we should have some more capacity towards the end of summer. And if you're a super awesome therapist and want to work for a really good organization, you're welcome to also reach out. And it's mobilemamatherapy.com.
I forgot I was muted there for a second. Elizabeth, and then Becky.
Yeah. The best way to reach me is email. I have a website as well, drelizabethwatt.com, and then my email is drelizabethwatt@gmail.com. If you Google me, you'll find that. And I feel really open for any of the questions that didn't get answered or any questions that come up. If you want to just shoot me an email and say you saw this panel and you have a question, or a friend has a question, that's a really quick way, and I'm happy to share resources and answer things that
way. Let's see. So do I answer the question of what happened to BCHM? I don't know that I want to take up time on this webinar. So I'm currently, my private practice for women's healthcare is, I'm currently practicing out of Bellingham Natural Family Medicine. So I see folks there 2.5 days a week. I'm still running the Village Circle. So you can find us. We just started our own Instagram page. We do have a closed Facebook page if people haven't been to the groups. But our Instagram is I don't use Instagram, but I think it's at Village Circle Bellingham is what it is. I would like to put a little quick plug that we are planning a Climb Out of Darkness, which is an annual fundraising event to raise awareness around perinatal mood and anxiety disorders. And you can check that out. Oh, I should have had that up. Maybe I'll send that to Elizabeth or something. I was supposed to do that earlier today. And folks can email me as well. And my email's really hard to say online, but because I have lots of letters and things. But it's Rebecca Shays, C as in cat, N as in Nancy, M as in Mary @gmail. And I'm also happy to field questions. And yeah, BCHM closed in June 30, almost a year ago, but we're still out there trying to do the work, and the Village Circle is never going to die. It's still going to be out there forever. So
And, you know, several people mentioned the Village Circle as a resource when we were even exploring this topic. And so just really want to appreciate that resource and all the affirming care that you all provide, and, you know, the healing, supportive, open, sex positive, you know, just beautiful resources that you're helping folks get closer to where they want to be, and to be more at peace and healed in their lives. So just deep gratitude for getting to listen and experience your wisdom today. And there was actually several in the moments in the Q&A that weren't even questions. They were, this has been an amazing hour. I learned so much. Thank you. So there was a lot of love being sent to each of you. So thank you so much. The caregivers and parents group at Western is where you can find the recording of this in the future. So that will get up sometime soon in the next week or two. And we have another event tomorrow for folks to connect who are Western Washington University staff members. So check that out on that webpage, and just wishing you all health and wellness. And yeah, that's it. Thanks a million.
Thank you.
Thanks, everyone. I'm leaving the meeting. That was amazing. You rock.
Thank you, Liz.
It was so nice to meet you, Elizabeth.
You too.
Take good care.
Bye.
Bye.
Bye, everybody.